Hi friends, welcome to Dr. Ram's Medical Coding Academy. We are going to kick off this session with this 2025 CPT code changes. From this session, you can understand the code changes that have taken place 2025 in our CPT manual by way of addition, deletion, and revision of these code sets. I hope you all are aware that the CPT manual changes on the 1st of January every year. We also call this as the Level 1 HCPCS. This year, there are 420 code changes in total. Let's have a quick glimpse of what these changes are. We have 270 codes being added, 112 codes being deleted, and 38 codes being revised, making a sum of 420. Now the question arises as who authorized these changes. Before that, you must know that this AMA, the American Medical Association, is entrusted with the responsibility of publishing the CPT manual. So we have something called as a CPT editorial panel of the AMA, which is responsible for bringing these changes. But then, why the change? You need to understand that we are in a profession which is expanding beyond leaps and bounds. The landscape of medicine keeps changing, and so does medical coding. We are actually doing the coding of medicine, which is the practice of medicine. There is modernization of medicine which is going on with the implementation of new technologies, new medications, and new way of performing procedures, operations, tests, and services. Practice of medicine has now become an evidence-based medicine, which should be more scientific and it should be more patient-centric. The treatment methodology must not do much harm to this patient. It must consider the patient as its center and provide an amenable therapy for all the disease conditions in this era of incurable and novel diseases. Well, going back to the topic of who is authorizing the changes in the CPT codes, there are 7 members in this editorial panel. Apart from that, we also have representatives from the various medical specialty societies. There are 11 members from the specialty societies, and we also have members from CMS, which is the Centers for Medicare and Medicaid Services, the American Health Association, AHA, Blue Cross Blue Shield, which is BCBS. We also have members from the health insurance plans and of course from the advisory committee of the editorial panel. The next question is, how are these changes implemented? Now, if there needs to be an addition of a code, it is not an easy decision. It takes around 2 years for the editorial panel to finally come up with a new code. There must be an application for an inclusion of a new code to the CPT editorial panel. This will be subject to a review by the CPT advisors, and a survey is also being conducted. Now, based on this review, the editorial panel can either accept or deny it. Now, if the CPT editorial panel is being convinced, then the code is either accepted. Then the code has a category assignment in the CPT code. You might be aware of this category 1, category 2, and category 3 codes. Category 3 codes are for future and emerging technologies. So a novel service can be represented by a category 3 code, and then this category 3 code will have to be converted to a category 1 code for a period of around 5 years. The meetings take place 3 times in a year in order to decide whether a code can be included or not. Now let's quickly see the actual changes in the entire CPT manual. Here's a slide where you can have a look at. We have 17 new codes for evaluation and management service, and the surgery contains 33 new codes. Radiology has 6 codes, and pathology has a highest of 114 codes. Medicine section contains 3 codes, and the category 3 has 81 codes. We also have an inclusion of 1 code in the multi-analyte algorithmic analysis, we notice that there has been no change in the anesthesia section. We report the zero codes for the anesthesia services. Let's quickly see the revisions and the deletions in the CPT manual. The evaluation and management section has zero revision, but then there are 3 deletions. The telephone services represented by 3 codes are being deleted, and we will have a separate video on the changes in each of these sections. Surgery section has 5 revised codes and 13 deleted ones. Pathology has got 9 codes revised and 14 deleted. Medicine section has 22 revised codes and 69 deletions, while the category 3 codes have 2 revision and 13 deletions. In total, we have 38 revised codes and 112 deleted codes. I hope this video is useful for you as coders because you are supposed to refer the new codebook effective January 1st of this year. I hope you are also aware that we have to assign the new codes only for claims that contain the date of services on or after January 1st, 2025. If you have a claim where the date of service is still the 31st of December 2024, you are supposed to report only the previous code sets. In the same way, when you're handling rejections and denials, please check the date of service and use the manuals accordingly. And if you are a person who is watching our YouTube for the first time, I am Dr. Ramasubbu. I have done my B.Sc Psychology, M.Sc Psychotherapy, a diploma in Bach Remedies, and then I've completed the homeopathic medicine BHMS, and then I've also done the MD. After that, I had joined this industry of medical coding and completed 33 certification exams offered by AAPC. I've also been the All India topper of AAPC and then acted as speaker for AAPC Chennai chapter. If you are interested to join this field of medical coding, then you can very well reach out to Dr. Ram's Medical Coding Academy, wherein we have training programs offered at 2 levels, Level 1 and Level 2. Level 1 is for freshers and Level 2 is for people who are taking up the examination. We have both classes in the weekdays and in the weekends. Here are the details. If you have got any questions or any doubts regarding medical coding, you can please reach out to us and post your questions in the comment box. I will try to respond as quickly as possible. In the meantime, we also have our next video regarding the code changes in each of these CPT code sections. So our next video is on the E&M changes. So please do watch that video as well. Please like and subscribe this video, and I will see you in the next video. Thank you.